In this video, I answer archive viewers' questions about MS symptoms. Don't turn away, because it starts right now. Howdy! Thanks for learning about MS with me, Aaron Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. If you're impacted by MS and you want to up your game, consider subscribing to the channel. And make sure to ring the notifications bell so you don't miss any of my upcoming content. I love doing Ask Me Anything MS Q&As, where I jump on live and answer your questions on the fly. Unfortunately, I can't get to every question live. And in this video, I'm going to be answering archived viewers' questions about various MS symptoms. There's enough of them, in fact, that this is going to be part one of a two-part series. So let's jump in and start answering questions. Sandra asks an outstanding question. How to explain to your family how you feel and that you're sick, especially when you look healthy, even though you feel tired and depressed and you're in pain. Sandra, you are not alone. So much of MS symptomatology is invisible to the naked eye, and you hear the expression, "Honey, you look so good." The reality is that many of the most debilitating symptoms in MS are invisible to the outside observer. They can't see your fatigue. They can't see your depression. They can't see your neuropathic pain or your vertigo or your issues with bowel and bladder and sexual function. And yet it is critically important that we help our village members, we help our close friends and family understand what we're going through so that they can be excellent support systems and be there for us. So how do we do that? One way is to invite them to clinic. Sometimes we'll invite a key village member, a husband or a wife or a close personal friend that might not fully get it to participate in the conversation. They'll listen to me describe what's going on. They'll listen to the patient's responses to my questions. They'll see the difficulties that that person has on their neuro exam. And I like to show them the MRI so they can quite literally see the holes in the brain. This is one way that I found helpful to help other people understand. The key element to take home is that of communication and open discussion. These people are your key village members. They love you. And I have to believe inside they want to understand. And so it's worth taking the time to explain to them. I one time said to a spouse, the best example I've come up with to help someone understand MS fatigue is as follows. Go to work on Monday and work a full day, come home, eat dinner, and that night, don't go to bed. Stay up all night watching Netflix. On Tuesday morning, take a shower, get up, go into work another full day, come home, have dinner with your family, and don't go to bed. Now Wednesday morning, let's go for a 10-mile walk and discuss fatigue. This is as close as I've come to trying to help others understand the significance of MS pathologic fatigue. I would like to hear from the guys and gals watching this video. What works for you? What tricks and tips can you offer to Sandra and to the other people in this global village to help them explain to their loved ones what they're going through? Please leave your comments and your questions below. I'm going to learn from reading them, and so will the viewers. Thank you in advance. Adam Murray writes, Hi Dr. B, your videos have taught me, I think, that I have pseudo-attacks with my previous optic neuritis. My vision is normally fine, but blurs after a shower. Is that correct? Yes, 100% you nailed it, Adam. When you have damage to part of the nervous system, and we'll use your example of the optic nerve, you can have a situation where during the acute optic neuritis, you go blind and you can't see at all. And then, as you recover, you regain some function, maybe part way, maybe all the way. But structurally, the optic nerve has taken a hit, and it doesn't work as well as it used to. And if you overheat your body, and I'm talking about raising your core body temperature even 1 degree, like you might in a shower, or if you're outside and it's hot in August, you can short circuit the circuit, and you'll again revisit blurred vision in that affected eye. One way to think about it is to think about an electrical cord. So imagine, if you will, that you have an extension cord that you use for your Christmas lights. And your spouse, not meaning to, ran it over with the car and crushed the cord, or maybe even cut the cord. Not all the way, but partially. And then they duct taped it up and put it back in the box. Now, the next December, when you get out your electrical cord for your Christmas lights and you plug in 2 Christmas lights, it works fine. But when you plug in 10 Christmas lights, it overloads the faulty circuit and they all go out. When you unplug 8 of those Christmas lights and you're down to only 2, it works again. And this is an example of that optic nerve that took a hit. A shower, particularly a warm shower, is an excellent example of heating the core body temperature and overloading the circuit. I am so glad, Adam, that you understand this concept, because if you didn't, you might scare yourself into thinking that various activities were causing exacerbations or making you worse. Please keep in mind, this doesn't make your vision worse, it's only temporary, and when your body cools down, it comes back. This is an excellent thing to understand, and thank you for bringing it up. Liam C. writes in, question: if a patient has isolated seizures as an early MS symptom, and none since on Keppra, which is a seizure medicine, would you consider trying to take them off Keppra at some point, or would you keep them on in this case? Liam, that's an excellent question, and there are too many variables to consider for me to give you an answer for you. But to speak in generalities, people with MS are upwards of 6 times more likely to experience a seizure as compared to the general population. And if you've had more than one seizure, we label that as epilepsy, and we put people on seizure medicines to prevent them from having more seizures. When we're trying to discuss whether or not we'll take someone off a seizure medicine, there are really 2 things we keep in mind. Is there any structural damage that you might see on the MRI? And does an EEG show electrical activity that's abnormal, where you would see a risk of having a seizure? Now, in the setting of MS, we're obviously going to see some structural damage, the lesions from multiple sclerosis. And as it stands, you may continue to be at risk for having seizures. Speaking in generalities, I'm not in a real big hurry to take someone off their Keppra. And if they're tolerating the medicine and they're not having trouble paying for the medicine and they're not having seizures, I might opt to leave well enough alone. It doesn't mean that you can't come off, but that's not one that I would want to risk, generally speaking. Thank you for asking the question, and remember, to find out the right answer for you, Liam, you have to talk to your MS provider and find out what's the exact answer with the exact appropriate variables for you. Thanks for asking the question. Sammy writes, cognitive impairments sucks. And Julian writes, I got lost in the parking lot when I parked 3 spots away from the door. It's okay, Sammy. MS is full of invisible symptoms, and cognitive impairment is one of the most impactful, one of the most common, and one of the most frustrating. I have an entire playlist on this channel dedicated to MS cognition with tricks and tips on how to beat it. And so I'm going to throw a link up above, and if you haven't checked that playlist out, I encourage you to do so. MS cognition is very, very frustrating, but that doesn't mean that we have to accept it laying down. And in fact, there's a lot that can be done to optimize MS cog fog. Check it out. Vital S writes, stupid Impera did nada for me. Vital, you're not alone. In fact, 2/3 of people that try Impera find that it doesn't help them. And the only way that we figured it out is to ask someone to take it twice a day for a month. At the end of the month, in my clinical experience, they either have what I call a Lazarus effect, like, oh my gosh, or they say, it didn't work. And if they say, it didn't work, then we take them off of it. Just for those that aren't familiar, Impera is a symptomatic medicine which can help people with MS overcome motor fatigue and heat sensitivity. It doesn't work in everyone, but oftentimes I find it's worth trying. And if you do find that it's helpful, it can make a really big difference. It's important to keep in mind that Impera is processed by the kidneys, and so you want to make sure that you don't have any kidney troubles. It also lowers seizure threshold, and so if you already have a seizure disorder, this is not the right medicine for you. Vidal, if you found that Impera didn't work for you, you might try some other modalities to combat motor fatigue and heat sensitivity. Things like timing activities when it's cool outside, like mowing the lawn first thing in the morning and at dusk right before the sun sets, not in the heat of the day. Or pounding ice water, or using cooling vests to cool your body as you're outside in the heat. These can also be very effective in combating motor fatigue and heat sensitivity. Pink Sparkling Glitter writes, question, what can I take to get my eyes to stop jumping, which affects my vision? I've had MS for 9 years now. Pink Sparkling Glitter, first off, love your name. Second of all, you're describing something called nystagmus. Nystagmus is a symptom which can be seen in MS when the brainstem, and specifically the centers that control yolked eye movements, are affected. And what can happen is the eyes can jump. It can be very, very frustrating, and it can also be super hard to treat. There are some medicines out there like Neurontin or gabapentin that have been shown in some patients to help. In other patients, we've had some success using barbiturates. But again, this is a challenging symptom to compete with. I wish you the best of luck, and I certainly hope that you'll work with your MS provider to try out some of these medicines to see if you can make the jumping eyes a bit better. Thanks for asking about nystagmus. The next two questions have to do with symptoms involving your voice. Angeli writes, question, how common is spastic dysphonia and the best treatment for it? I already take max dose of baclofen. And Regina writes, question, is voice loss common? I've been taking care of folks impacted by MS for over a decade and a half. And I'll share that it's not uncommon that over time, some patients develop difficulties with their voice. They may have trouble in projecting their voice to be loud enough that others can hear, or they may develop a dysarthria. Dysarthria is a doctor word for difficulty in pronouncing words. Here, Angeli used the term dysphonia, which means very similar things. It doesn't sound right. You're having trouble producing speech. This is something that we can see in MS. And my number one tool to combat it is to work carefully with a speech pathologist. Speech pathologists are amazing people that are specifically trained to help with speaking and swallowing. And if you guys haven't seen one yet, I would certainly encourage it. I've had good success with speech pathologists helping people vocalize loud enough that others can hear and to optimize their speech so that others can understand. Melissa shares that she needs to have surgery on her cervical spinal column, working on the discs, and writes that she has a lesion in that area. And so the question is it safe to have surgery? Now, this shows up more often than you might think, where someone with MS has lesions in their spinal cord, and, as nature would have it, they also have degenerative discs in their neck that need surgery. And the question often comes up, what do we do? Here's the way that I think about it. If that person who has both problems develops new difficulties with their spinal cord, I don't know which one it is. I don't know if it's coming from the MS or if it's coming from the compression of the neck. And so I would recommend considering surgery because we can literally remove one of the two problems. If the disc issue is corrected surgically, then we're only left with the MS, and it makes it easier to know what's going on and to treat. Now, obviously, there's a lot that goes into surgery, and I can't answer, Melissa, specifically for you if it's safe. But I will say that having lesions in your spinal cord is not a contraindication to having neck surgery. Thank you for asking the question, and best of luck. I'm going to wrap up part 1 of this 2-part series so that this individual video doesn't get too long. Make sure that you check out part 2, where I will continue to answer archived viewers' questions about MS symptoms. My name's Aaron Boster, and thank you for learning about MS with me. If you'd like to learn more about MS, click that video right there. YouTube Analytics thinks that you would love that video right there. And if you haven't yet subscribed to the channel, please consider doing so. Just click that circle with my face in it. Go ahead, click my face. Until my next video or my next live stream, take care.